Hi future nurses, welcome back to Step Into Your Dream. This is part 2 of our tuberculosis series. If you missed part 1, we covered what TB is, the difference between latent and active TB, and airborne precautions. In this video, we will break down RIFE therapy, the first-line treatment for active TB, and then test your knowledge with NCLEX-style practice questions. Treatment adherence is everything when it comes to curing TB and preventing drug resistance. The standard first-line therapy is RIFE therapy. R stands for Rifampin, which this medication turns body fluid, for example, urine, tears, sweat, red to orange. This is harmless effect but can stain contact lenses. It's really important to teach your patient to expect these changes so they don't panic. I stands for Isoniazid or INH. This medication can cause vitamin B deficiency, which in result patient may feel and experience peripheral neuropathy. Then advise patients to take vitamin B6 supplements while they are on this medication. Also, they need to avoid aluminum-containing antacid for at least 1 hour after taking INH. Also, the best way to take this medication is on an empty stomach. P stands for Pyrazinamide. This medication can increase uric acid levels, which in result patient may experience gout attack. We need to monitor kidney function to make sure kidneys are not affected by increasing uric acid level, and also they need to take this medication with food to reduce stomach upset. E stands for Ethambutol. This medication can cause optic neuritis, which is gonna decrease visual acuity. Then we better to educate patient about the importance of monitoring vision regularly. Treatment duration. Active TB treatment typically lasts 6 months or longer. Nurses are essential in making sure patients stick to the plan, monitoring for side effects, and providing a thorough education. Also remember, all RIFE medications are hepatotoxic. Then patient needs to get educated about avoiding alcohol and also monitoring liver enzymes. We need to teach them to report any jaundice, dark urine, and fatigue immediately. Now let's do quick recap. Take all medication exactly as prescribed, avoid alcohol, attend regular follow-up appointment and lab tests, educate on home isolation precautions if needed, and screen household contacts for TB exposure. Now NCLEX tip. Always remember the harmless versus harmful effect of RIFE medication. Harmless, for example, Rifampin we said turns urine and body fluid to orange color. Harmful, we mentioned about hepatotoxicity, peripheral neuropathy, gout attack, and optic neuritis. Now let's review some NCLEX-style questions. Question 1. A patient has active TB. Which precautions should the nurse implement? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. And D. Standard precautions. Exactly, airborne precautions. Question 2. A patient with latent TB asks why they don't need to wear a mask. What is the best response? A. You are contagious but only sometimes. B. Latent TB means you are not contagious. C. You should always wear a mask at home. And D. Latent TB requires isolation in the hospital. Correct. Latent TB means you are not contagious. Question 3. Which statement by a patient shows understanding of RIFE therapy? A. I can stop taking the medication when I feel better. B. I must take all medications for the full course even if I feel well. C. I only need the antibiotic for a few weeks. D. It's okay to skip doses if I forget sometimes. Exactly. I must take all medications for the full course even if I feel well. Awesome! If this video helped you, hit that like button and subscribe for more nursing school tips and NCLEX prep. Comment below if you want more infection control breakdowns or sample NCLEX questions. Until next time, keep learning and keep dreaming big. Thanks so much for watching.